And now we will focus on the superficial muscles of the anterior arm. First up is the triceps brachii. This is the lateral head, and this is the medial head, and then here we have the long head. The origins of the triceps brachii are inferior margin of glenoid cavity, and for the lateral head, posterior humerus, and the medial head, the distal radial groove on posterior humerus. The insertion for the triceps brachii is olecranon of ulna, and the action of the triceps brachii is the powerful forearm extensor. And then we will move on to the biceps brachii, right here. It is contained of the short head and the long head. The origin of the short head is the coracoid process, and the origin of the long head is the supraglenoid tubercle and glenoid cavity. The insertion of biceps brachii is the radial tuberosity. The action of biceps brachii is that it is a powerful flexor and supinator. And now moving on, we have the brachialis, which is this section right here and this. The origin of the brachialis is that it's the distal portion of anterior humerus, and the insertion is the coronoid process of ulna. The action is that it is a flexor of the arm. Next up, we have the brachioradialis, which is located right here. The origin of the brachioradialis is the lateral ridge at distal end of the humerus, and the insertion is the base of the radial styloid process. And the action of the brachioradialis is that it is the synergist in forearm flexion. And we have the anconeus located right here. The origin of the anconeus is the lateral epicondyle of humerus, and the insertion is the lateral aspect of the olecranon of ulna. The action of the anconeus is that it abducts the ulna during forearm pronation. And that is it for the superficial muscles of the anterior arm.
So here we have the flexor digitorum profundus, and the origin is the anterior medial surface of the ulna and the interosseous membrane and the coronoid process of the ulna. The insertion is the distal phalanges of fingers 2 through 5, and the action is that it flexes the distal phalanges. The next muscle is the pronator quadratus, and the origin is the distal portion of the anterior ulnar surface, and the insertion is the anterior surface of the radius and distal end, and the action pronates the forearm. The pronator teres is this muscle right here, and the origin is the medial epicondyle of the humerus and the coronoid process of the ulna, and the insertion is the mid shaft of the radius, and the action pronates the forearm. The flexor carpi radialis is right here, and the origin is the medial epicondyle, and the insertion is the base of the metacarpals 2 through 3, and the action is the power flexor and abductor of the hand. The next is the palmaris longus, which is this muscle right here. The origin is the medial epicondyle of the humerus, and the insertion is the palmar aponeurosis and fascia of the palm, and the action, it tenses the skin and the fascia of the palm. The flexor carpi ulnaris is this muscle right here. The origin is the medial epicondyle of the humerus and olecranon and the posterior surface of the ulna. The insertion is the base of metacarpal 5 and the pisiform and hamate bones. The action flexes and adducts the hand. The next one is the flexor digitorum superciliaris. The origin is the medial epicondyle of the humerus, the coronoid process of the ulna, and the shaft of radius. The insertion is the medial phalanges of fingers 2 through 5, and the action is that it flexes the hand and middle phalanges of fingers 2 through 5. The last muscle is the flexor pollicis longus, and the origin is the anterior surface of the radius and interosseous membrane, and the insertion is the distal phalanx of thumb, and the action, it flexes the thumb.
So first we have the extensor indicus. The origin is the posterior surface of the distal ulna and interosseous membrane. The insertion is the exterior expansion of index finger. And it joins the tendon of extensor digitum. Its action is to extend the index finger. Next is the extensor pollicis longus, which is right here. And then the extensor pollicis brevis, which is there. The origin is the dorsal shaft of ulna and radius. The insertion for the longus is the base of the distal phalanx of thumb, and for the brevis, it's the proximal phalanx. The action is to extend the thumb. Next is the abductor pollicis longus, right here. Its origin is the posterior surface of radius and ulna, also the interosseous membrane. The insertion is metacarpal 1 in the trapezium. Action is that it abducts and extends the thumb. Next is the supinator, right here. Its origin is the lateral epicondyle of humerus and the proximal ulna. The insertion is the proximal end of the radius. Its action is that it's a synergist of bicep brachii to supinate the forearm. Next, we move over to this picture, and we're going to look at the extensor carpi radialis longus, which is right here. The origin is the lateral supracondylar ridge of the humerus. The insertion is the base of metacarpal 2. Its action is to extend and abduct the hand. Next is the extensor digitum, which is found right here. Its origin is the lateral epicondyle of the humerus. Its insertion is by 4 tendons into distal phalanges of fingers 2 through 5. Its action, that is the prime mover of finger extension. Next, the extensor carpi ulnaris, right here. The origin is the lateral epicondyle of the humerus and the posterior border of ulna. insertion is the base of metacarpal 5. Its action is to extend and adduct the hand. Lastly, we have the extensor carpi radialis brevis. That is found right here. The origin is the lateral epicondyle of humerus. The insertion is the base of metacarpal 3, and its action is to extend and abduct the hand.
Now we are going to do the muscles of the hand. First we have the flexor pollicis brevis, which is found right here on the hand. The origin is the flexor retinaculum and nearby carpals. The insertion is lateral side of the base of proximal phalanx of thumb. That is going to be right here. The action is that it flexes the thumb. Next is the opponens pollicis, which is found here. The origin is the flexor retinaculum and trapezium. The insertion is the whole anterior side of metacarpal 1. The action is opposition, which is when the thumb touches the fingers of the same hand. The origin of the adductor pollicis is the capitate bone and bases of metacarpals 2 through 4 and the front of metacarpal 3. The insertion is the medial side of proximal phalanx of the thumb. The action is it adducts and helps to oppose the thumb. The abductor digiti minimi is here. The origin is the pisiform bone. The insertion is the medial side of proximal phalanx of the little finger. This abducts the little finger. The flexor digiti minimi brevis is here. The origin is the hamate bone and flexor retinaculum. The insertion is the same as the abductor digiti minimi. This flexes the little finger. The opponens digiti minimi is here. The origin is the same as the flexor digiti minimi brevis. The insertion is the most of the length of medial side of metacarpal 5. The action is helps in opposition, which is metacarpal 5 to the thumb. The lumbricals the origin are the lateral side of each tendon of flexor digitorum profundus in the palm. The lumbricals are here. The insertion are the lateral edge of extensor expansion on proximal phalanx of 2 through 4. This flexes the fingers at the joints, but extends them at separate joints. The palmar interossei are here. The origin is the side of each metacarpal that faces the mid-axis of the hand, 3, but absent from the actual third. The insertion is extensor expansion on the first phalanx of each finger except 1. The action is it adducts the fingers.
The dorsal interossei are here. The origin are the sides of the metacarpals. And the insertion is extensor expansion over proximal phalanx of 2 through 4 fingers on side opposite to mid-axis of hand metacarpal 3, or phalange 3, on both sides of the 3 finger. The action is it abducts the fingers or diverges them. The final muscle of the hand is the abductor pollicis brevis, which is here. The origin is the flexor retinaculum and nearby carpals. The insertion is the lateral base of thumb's proximal phalanx, and this muscle abducts the thumb.
So the first muscle is the iliacus, and that is this muscle right here. And the origin is the iliac crest and the fossa, and it's also the ala of the sacrum. The insertion is the lesser trochanter and of the femur via the iliopsoas tendon, and the action is the prime mover for flexing the thigh or the trunk on the thigh. The next muscle is the psoas major, and that is this muscle right here. The origin is the fleshy strips from transverse processes, bodies, and disc of lumbar vertebrae, and also T12 vertebrae. The insertion is the lesser trochanter of femur via the iliopsoas tendon, and the action is the prime mover for flexing the thigh, and it also flexes vertebral column laterally. The next muscle is the sartorius, and that is this muscle right here. The origin is the anterior superior iliac spine. The insertion is that it winds around medial aspect of the knee and inserts into the medial aspect of the proximal tibia. And the action is it flexes, abducts, and laterally rotates the thigh. The next muscle is the adductor magnus, and those are these muscles right here. And the origin is the ischial and pubic rami and ischial tuberosity. The insertion is the linea aspera and adductor tubercle of femur. The action is that it adducts and medially rotates and flexes the thigh, and it also helps with thigh extension. The next muscle is the adductor longus, and that is this muscle right here. And the origin is the pubis near the pubic symphysis. The insertion is the linea aspera, and the action is that it adducts, flexes, and medially rotates the thigh. The next muscle is the adductor brevis, and that is this muscle right there. And the origin is the body and inferior pubic ramus. The insertion is the linea aspera above adductor longus, and the action is that it adducts, flexes, and medially rotates the thigh. The pectineus is this muscle right here, and the origin is the pubis. The insertion is from the lesser trochanter inferior to the linea aspera on posterior aspect of femur, and the action is it adducts, flexes, and medially rotates the thigh. The brachialis is this muscle right here. The origin is the inferior ramus and pubis of the adjacent ischial ramus. The insertion is the medial surface of tibia just inferior to its medial condyle, and the action is that it adducts the thigh, flexes, and medially rotates the leg. The next muscle is the rectus femoris, and that is this muscle right here. The origin is the anterior, inferior, iliac spine, and superior margin of the acetabulum. The insertion is the patella and tibial tuberosity via the patellar ligament. And the action is it extends the leg and flexes the thigh at the hip. The next one is the vastus lateralis, and that is this muscle right here. The origin is the greater trochanter, the intertrochanteric line, and the linea aspera. The insertion is the patella and tibial tuberosity via the patellar ligament, and the action is that it extends the leg and stabilizes the knee. The last muscle is the vastus medialis, and that is this muscle right here. The insertion is the linea aspera, intertrochanteric, and the medial supracondylar lines. And the insertion is the patella and tibial tuberosity via the patellar ligament, and the action is that it extends the leg.
Next, we are going to look at the muscles that move the thigh and the leg at the posterior portion. First, we're going to look at the obturator externus. The origin of the obturator externus is the outer surface of obturator membrane, pubis, and ischium, margins of obturator foramen, and the insertion is by a tendon into trochanteric fossa of posterior femur. The obturator externus is not shown on this, but it's going to be medial and deep to this number 14, which is the obturator internus. So it's going to be around in here. The action is as the same as the piriformis. Next is the obturator internus, which is number 14 here. The origin is the inner surface of obturator membrane, greater sciatic notch, and margins of obturator foramen. The insertion is greater trochanter in front of the piriformis, and the action is the same as the piriformis. The gemellus comes in superior and inferior, so it's going to be the 13 is the superior, and the 15 is going to be inferior. The origin is the ischial spine, which is superior, and then the inferior is the ischial tuberosity. The insertion is the greater trochanter of the femur, and the action is also for the piriformis. The last muscle is the quadratus femoris, which is number 16, and that's here. The origin is the ischial tuberosity. The insertion is the intertrochanteric crest of femur, and the action is that it rotates the thigh laterally and stabilizes the hip joint. Now we are going over the movements of the thigh and the leg on the anterior portion of the leg. First, we are doing the vastus intermedius, which is number 21 here. The origin is anterior and lateral surfaces of proximal femur shaft, and the insertion is as for the rectus femoris. This extends the leg. Next is the tensor fascia lata, which is number 17, which is here. The origin is the anterior aspect of the iliac crest and anterior superior iliac spine. The insertion is the iliotibial tract. The action steadies the leg and trunk on thigh by making iliotibial tract taut, which is flexes and abducts thighs and rotates the thigh medially. Next, the gluteus maximus is number 10 found here. The origin is the dorsal ilium, the sacrum, and the coccyx. The insertion is the gluteal tuberosity of the femur and the iliotibial tract. The action is the major extensor of the thigh. Next is the gluteus medius, which is found deep to this. This is found here. The origin is between anterior and posterior gluteal lines on lateral surface of ilium. The insertion is by the short tendon into lateral aspect of greater trochanter of the femur. This muscle abducts and medially rotates the thigh. Next is the gluteus minimus, which is not shown on the muscleman, but can be found in the book. The gluteus medius is right here. The gluteus minimus is right here. origin is between anterior and inferior gluteal lines on external surface of the ilium. The insertion is anterior border of greater trochanter of the femur, and the action is the same as the gluteus medius. The piriformis is also not found on the Musselman, but is found in your book, and the piriformis is found right here. The origin is the anterolateral surface of sacrum, opposite of the greater sciatic notch, and the insertion is the superior border of greater trochanter of the femur. The action is it rotates extended thigh laterally.
So now we're going to talk about the three muscles that make up the hamstring. First is the bicep femoris. As you can see from this picture, it has both a long head and a short head. The origin for the long head is the linea aspera and the lateral supracondylar. The short head origin is the distal femur. The insertion is the common tendon passes downward and laterally to insert into the head of the fibula and lateral condyle of tibia. Action is that it extends the thigh and flexes the leg. Next is the semitendinosus. The origin is the ischial tuberosity in common with the long head that we just talked about of the bicep femoris. The insertion is the medial aspect of upper tibial shaft, and the action is that it extends thigh and flexes leg. The last muscle is the semimembranosus. The origin that can be found right there. The origin is the ischial tuberosity. The insertion is the medial condyle of tibia. And like the other two muscles, the action is that it extends the thigh and flexes the leg.
And now we will focus on the muscles of the ankle and the foot. Start off with, we will focus on the lateral compartment. And first is fibularis longus, which is located right here. And the origin of the fibularis longus is the head and the upper portion of the fibula. And the insertion is by long tendon under the foot to metatarsal 1 and medial cuneiform. The action is that it plantar flexes and everts the foot. Next is the fibularis brevis, which is located here, but deep to the fibularis longus. And the origin of the fibularis brevis is the distal portion of the fibula shaft, and it inserts by the tendon running behind the lateral malleolus to insert on proximal end of metatarsal 5. And the action is that it plantar flexes and everts the foot. And now we will focus on the anterior compartment. To start off with, we have the tibialis anterior. And this is located right here. The origin of the tibialis anterior is the lateral condyle and upper 2/3 of the tibia and the interosseous membrane. And the insertion is by the tendon into inferior surface of the first cuneiform and metatarsal 1. And the action is that it is the prime mover of dorsiflexion. Next, we have the extensor digitorum longus, and that is located right here. The origin is the lateral condyle of tibia and the proximal 3/3 of the fibula and the interosseous membrane. The insertion is the tendon that divides into 4 parts, and it inserts into the middle and distal phalanges of toes 2 through 5. And the action is that it is the prime mover of toe extension. And next we have the fibularis tertius, and that is located right here. And the origin of the fibularis tertius is the distal and anterior surface of the fibula and interosseous membrane. It inserts into tendon that inserts on dorsum of metatarsal 5, and its action is that it dorsiflexes and everts foot. Next is the extensor hallucis longus, which is located here deep to the extensor digitorum and longus and tibialis anterior. The origin is the anteromedial shaft of the fibula and the interosseous membrane. It inserts into the tendon that inserts on distal phalanx of the great toe, and its action is that it extends the great toe. Next, we will focus on the superficial posterior compartment. First up is the gastrocnemius, which is located right here. The origin of it is by the two heads from the medial and lateral condyles of the femur, and it inserts into the calcaneus via the calcaneal tendon, and its action is that it plantar flexes the foot. Next is the soleus, which is located right here deep to the gastrocnemius, and its origin is the proximal portion of the tibia and the fibula and the interosseous membrane. It inserts into the calcaneus via the calcaneal tendon, and it also helps in plantar flexion. And finally, we have the triceps surae, which is the combination of the gastrocnemius and the soleus, and its insertion is via the common tendon into the calcaneus of the heel, and its action is that it plantar flexes the foot. And that is it for the muscles that move the foot and the ankle.
Next, we are going to talk about the extensor digitum brevis. The origin is the anterior part of the calcaneus bone, and the insertion is the base of the proximal phalanx of greater toe, extensor expansions on the second through fourth toes. The action is that it helps extend toes at metatarso-pharyngeal joints. Now we're going to talk about the muscles on the sole of the foot. First is the flexor digitum brevis. That can be found right here. The origin is the calcaneal tuberosity, and the insertion is the middle phalanx of the second through fourth toes. Action is that it helps flex the toes. Next is the abductor hallucis, found right here. The origin is the calcaneal tuberosity and flexor reticulum. The insertion is the proximal phalanx of the greater toe. Action is that it abducts the great toe. Next is the abductor digiti minimi. Can be found right here. The origin, again, is the calcaneal tuberosity. The insertion is the lateral side of the base of the little toe, proximal to the phalanx. The action is that it abducts and flexes the little toe. Next is the flexor accessorius. The origin is the medial and lateral side of the calcaneus, down here. And then the insertion is the tendon of flexor digitum longosus in midsole. The action is that it straightens out the oblique pull of flexor digitum longus. Lastly, there is the lumbricalis, which is right here, which can be found those spots. The origin is from each tendon of flexor digitum longus. The insertion is the exterior expansion on proximal phalanx of second through fifth toes, and the action is the flexed toes at the metatarso-pharyngeal joint and extends toe at interpharyngeal joints. Going deeper into the sole of the foot, you will find the flexor hallucis brevis, which is found right here. The origin is the lateral cuneiform and cuboid bones. The insertion is the two tendons on the base of the proximal phalanx of greater toe. The action is that it flexes the great toe at the metatarsopharyngeal joint. Next is the adductor hallucis, which is found here. It has both the transverse head and the oblique head. The origin of the oblique head is from bases of metatarsals 2 through 4 in the fibroalis longus tendon sheath. For the transverse head, it's from a ligament across the metatarsopharyngeal joints. The insertion is the base of the proximal phalanx of great toe on the lateral side. The action that it helps maintain the transverse arch of the foot. Next muscle is the flexor digiti minimi brevis. It can be found over here. The origin is the base of metatarsal 5 and tendon sheath of fibroalis longus. The insertion is the base of proximal phalanx of fifth toe. The action is that it flexes the little toe at metatarsopharyngeal joint. Lastly, you have the plantar and dorsal interossei, which can be found over here. The plantar and then the dorsal. We'll talk about the palmar and dorsal interossei later on in the video, and they have similar origin, insertion, and action as those.